Cornea stem cell transplants helped restore vision after chemical burns. Autologous transplants, stem cell therapy, is a potential treatment for retinal degeneration disorders also. The first ever corneal stem cell transplants in the U.S. proved feasible and safe, allowed patients to receive new corneas, and in some cases, improved vision. The corneal epithelium is essential for maintaining a clear ocular surface. Corneal damage, for example due to alkali burns, can destroy the corneal epithelium, resulting in opacification and blindness. The limbus, a ring of tissue at the edge of the cornea, contains stem cells that divide and differentiate into the corneal epithelium over the lifetime of an individual. They showed that permanent restoration of a transparent, renewing corneal epithelium was observed in 76.6% of eyes and was stable at 10 years. The 4 patients who underwent transplantations had limbal stem cell deficiency caused by chemical burns. The patients were all men, ranging in age from 31 to 52. The first patient had corneal opacity clearance at 3, 9, and 12 months after transplantation. The patient still had limited vision in the affected eye at 12 months because of intrastromal opacity, but subsequently underwent a corneal transplant. The second patient had ocular surface reconstruction 8 years before enrolling in the KLEC study, but still had corneal opacification. Opacity persisted to 9 months after the limbal stem cell transplant, but had improved by 12 months. The patient's best corrected visual acuity, BCVA, improved from 20/40 to 20/30. The third patient had complete corneal opacification at enrollment, 5 months after the chemical burn. Following KLEC transplant, corneal opacification improved during follow-up visits at 3, 9, and 12 months. The epithelial defect had resolved by 12 months, and the patient's vision had improved from hand motion to 20/30. The fourth patient enrolled in the study 30 years after an acid burn. He had complete opacification, extensive neovascularization, and lagophthalmosis. After an initial biopsy did not lead to a viable limbal stem cell construct, the patient underwent a successful biopsy 3 years later. BCVA improved from hand motion at baseline to finger counting at 12 months. Conjunctivalization resolved, and neovascularization and corneal staining improved, allowing the patient to prepare for a corneal transplant. Second case about retinal degeneration stem cell therapy is a potential treatment for retinal degeneration disorders, such as age-related macular degeneration, diabetic retinopathy, retinitis pigmentosa, and Stargardt's disease. Stem cell therapy can improve visual acuity by repairing damaged retinal tissue. Saponin B2, SSB2, extracted from Bupleurum kawai root, a traditional liver disease remedy, can block hepatitis C virus, HCV, entry into cells, according to Canadian and Taiwanese researchers. Since new therapies against hepatitis C are extremely expensive, we believe SSB2 may be of value as a cost-effective anti-HCV agent for the management of hepatitis C, particularly in the liver transplant setting, said Dr. Christopher D. Richardson of Dalhousie University in Halifax. Dr. Richardson and colleagues used infectious HCV culture systems to examine the effect of SSB2 and other psychosaponins on the complete virus life cycle. They also examined the antiviral activity of the substances against various HCV genotypes, clinical isolates, and infection of primary human hepatocytes. In particular, we identified SSB2 as an efficient inhibitor of early HCV entry, including neutralization of virus particles, preventing viral attachment, and inhibiting viral entry/fusion. SSB2 also showed activity against various HCV genotypes and blocked HCV infection of primary human hepatocytes, they say. SSB2 does not appear to disrupt cell membranes and accumulate within the host cell, indicating that the extracellular virus is its target. The researchers suggest that SSB2 mediates its antiviral effects, at least in part, by acting on HCV glycoproteins during the initial stages of infection. Our data support the need for further preclinical investigation of SSB2 for use in prophylactic or combination therapies against HCV infection. Furthermore, its structure could serve as a lead compound for future anti-HCV drug development. Dr. Sanjeev, stem cell researcher, mentioned that other liver conditions causing liver failure or hepatorenal syndrome may recover under stem cells potentiation, although liver has high capacity to regenerate, thus avoids liver transplant. For further information and management and treatments, PL connect Dr. Sanjeev on WhatsApp AP 9323275869.